Hello, first year BDS students. I'm Dr. Alpana Kesar, and in this video, I will share very important information regarding the anatomy syllabus in first BDS. The Dental Council of India, also called DCI, is the governing body for all the dental colleges in India and regulates the BDS course to be followed in the dental colleges. DCI has issued a booklet on BDS Course Regulation 2007 available in the PDF form on their website. I have shared the link of the same in the description of this video. This regulation recommends the syllabus of all the subjects for all the 4 years of BDS course to be followed in the dental colleges, including the syllabus of anatomy. However, students may also refer to the syllabus booklet issued by their respective colleges as the syllabus may slightly vary from one university to another. The syllabus of human anatomy for first BDS as recommended by Dental Council of India is as follows. On the page 37 of the booklet is present the details of the course of anatomy. It starts with Introduction to Anatomy and all the topics to be studied under the Introduction to Anatomy. This is followed by Head and Neck Anatomy, in which all the topics to be studied in head and neck anatomy are described. This is followed by all the topics that have to be demonstrated on a dissected specimen in thorax and abdomen on page 37, followed by all the clinical procedures that have to be demonstrated to the students during first BDS in anatomy. On page 38 is described all the topics in embryology, histology, and medical genetics which are to be studied by the students of first BDS in the department anatomy. Page 38 also mentions the recommended books in anatomy for the BDS students. Further, going into the details of the syllabus and highlighting the important topics, Introduction to Anatomy is also called General Anatomy. In this, students are made familiar with the terms related to position and movement. They are taught about the structure of skin, superficial fascia, and deep fascia. In muscles is taught the structure of muscle and its functioning. In bones, the structure of bones and the type of bones and their ossification is taught. In joints, structure of joints and classification is taught. In circulatory system, cardiovascular system and lymphatic system is taught to the students, followed by the nervous system. For studying general anatomy, students can refer to any of these textbooks by Dr. B.D. Chaurasia, Dr. Vishram Singh, Dr. Subhadra Devi, or any other textbook that they like to read. Students can even refer to the class notes given by the teachers, which should be sufficient for studying general anatomy. The second part of the anatomy syllabus is head and neck anatomy. Head and neck anatomy is most important for dental students. It is so because 1. Students should be thorough with the structure of head and neck region. 2. The head and neck anatomy has maximum weightage in the final exams as 70 to 80% of the questions are from head and neck anatomy. The textbooks in anatomy which are recommended by the teachers are Snell's Clinical Anatomy, Gray's Anatomy for Students. Teachers also recommend atlas such as by Netters. However, the popular choice of textbooks amongst the students is Textbook on Human Anatomy by Dr. B.D. Chaurasia, by Dr. Inderbir Singh, by Dr. Vishram Singh, etc. It is not important which textbook the students are using. What is important is that the method of learning anatomy should be correct. So what is the best method of learning anatomy? It has been said that dissecting once is equal to reading 100 times because when student dissect, he makes the visual memory of the subject. That is not a practical option though, and so the next best practical option is to make use of diagrams and visuals which are similar to the dissected specimens. As students read the text, they should keep correlating it with the diagrams and the visuals and thus make a visual memory of the text. To make the understanding and learning of anatomy subject a little easier, I have published a playlist of 18 videos with a total watch time of 10 hours. In 10 hours, students can complete almost the entire head and neck syllabus of anatomy. The link of the playlist is available in the description of this video. The first chapter in head and neck anatomy is scalp. In scalp, the following topics are done. Layers of the scalp, blood supply of the scalp in which arterial supply and venous drainage is covered. Nerve supply of scalp, both sensory and motor nerve supply of scalp is done. Lymphatic drainage of scalp and applied anatomy or clinical anatomy. The second chapter is face, in which the following topics are done. Muscles of face or muscles of facial expression. Blood supply of face, which will include arterial supply and venous drainage of face. Nerve supply, sensory and motor nerve supply of face is done. Lymphatic drainage of face and applied anatomy or clinical anatomy. The third chapter is lacrimal apparatus, which will include the lacrimal gland. The fourth chapter is parotid gland, in which location, size, and coverings of parotid gland is done, followed by borders and surfaces, relations, secretomotor nerve supply of parotid gland, parotid duct, and applied anatomy. The next chapter is submandibular region and submandibular gland. In this is covered the muscles in the submandibular region, which is also called the suprahyoid muscles. In the submandibular gland, the location, shape, and parts of the gland is done, followed by the relations of the gland, secretomotor nerve supply, submandibular gland duct, and the clinical anatomy. In this chapter is also covered the sublingual salivary gland and submandibular ganglion. The next two chapters are temporal and infratemporal fossa and pterygopalatine fossa. And all the topics that are covered in these two chapters are very important from the exam point of view. And the topics that are covered in these two chapters are the muscles of mastication, temporomandibular joint, mandibular nerve, maxillary artery, otic ganglion, and pterygoid plexus of veins. In the pterygopalatine fossa, maxillary nerve and pterygopalatine ganglion are covered. The next chapters are oral cavity, which will include hard and soft palate, and tongue. In tongue, the topics that are covered are surface features of tongue and papillae of the tongue, muscles of the tongue, that is both extrinsic and intrinsic muscles, arteries and veins of the tongue, lymphatic drainage of the tongue, and innervation or nerve supply of the tongue. In nose and paranasal air sinus, nasal cavity, that is medial and lateral wall of the nose, is covered, and in the paranasal air sinus, the frontal air sinus, maxillary, ethmoidal, and sphenoidal air sinuses are covered. The next chapter is pharynx, in which nasopharynx, oropharynx, and laryngopharynx is covered, followed by the structures of the wall of pharynx. Constrictor and longitudinal muscles of pharynx is done, followed by sensory and motor nerve supply of pharynx. Blood supply of pharynx is also covered. In this chapter is covered auditory tube, Walde's lymphatic ring, and palatine tonsil. In the chapter larynx will be covered the functions of larynx, followed by the cartilage, joints, ligaments, and membranes of larynx. Inlet, outlet of larynx and laryngeal cavity will be covered, followed by muscles and the movement brought about by the muscles of larynx. In this chapter will also be covered the nerve supply, blood supply, and lymphatic drainage of larynx. In the chapter orbital cavity will be covered eyelids, extraocular muscles of the eyeball, blood supply of structures in the orbital cavity, nerve supply of structures in the orbital cavity, and ciliary ganglion. In the neck is included the superficial and deep structures such as the superficial and deep fascia, muscles and triangles of the neck, the blood vessels of the neck, the nerves of the neck, and deep structures such as the thyroid gland, styloid apparatus, and the joints of the neck. GCI recommended syllabus for the cranial cavity and neuroanatomy includes meninges, parts of brain, ventricles of brain, dural venous sinus, cranial nerves attached to the brain, pituitary gland, and the following cranial nerves: third, fourth, fifth, sixth, seventh, ninth, and 12th to be done in detail. In osteology, or the study of bones, will be included the study of the fetal skull, adult skull including mandible, which will be studied under the following subheads: norma verticalis, norma occipitalis, norma lateralis, norma frontalis, norma basalis, cranial cavity, and mandible. Next is hyoid bone and cervical vertebra. Moving on to histology or microanatomy, students can use any of the textbooks recommended by their teachers for histology or microanatomy. My advice to the students is to maintain a good practical record file for histology, in which students should draw for every slide a well-labeled diagram with 5 to 6 identifying features written for the same. Students can use this practical record file for preparing for the final exams, which will save a lot of time in the end. The topics that are to be done by the students in histology are cell, epithelium, both simple and stratified, connective tissue, cartilage, bone, muscle, lymphatic tissue, in which students must learn and understand the slides of lymph node, spleen, tonsil, and thymus, cardiovascular tissue, that is both arteries and veins, nerves and ganglion, and salivary glands, in which students must understand and learn the slides of parotid, submandibular, and sublingual salivary glands, which is also a frequently asked question in the examinations. In histology of endocrine glands, students must learn the slide of thyroid, parathyroid, adrenal, and pituitary gland. They should also study the slides of skin, that is both thin skin and thick skin. Histology of lip, tooth, tongue must be done. In GI tract, students must do slides of esophagus, stomach, intestine, cecum, appendix, colon, rectum, and anal canal. Liver, gallbladder, and pancreas must be done. In the respiratory system, trachea, epiglottis, bronchi, and lungs. In the urinary system, slides of kidney, ureter, and urinary bladder is to be done. And in the reproductive system, testes and ovaries. Next, we move on to embryology. According to the recommendations of Dental Council of India, general embryology and head and neck embryology are included in the course. Students can use any of the textbooks recommended by their teachers to study embryology. My suggestion to the students is to prepare a short note on each of the topics included in the syllabus of embryology and use these short notes for studying embryology at the time of examinations. The topics to be covered in general embryology are oogenesis, spermatogenesis, fertilization, morula and blastocyst, implantation, bilaminar and trilaminar germ disc, intraembryonic mesoderm, its formation and fate, primitive streak, notochord, its formation and fate, neural crest, neural tube, placenta and its anomalies, IVF and twinning. According to the recommendations of Dental Council of India, after completing the general embryology, students directly go to the head and neck embryology. And in head and neck embryology, students must cover the following topics: pharyngeal arches, clefts, and pouches, development of the following structures, that is, face and nose, tongue, palate, thyroid, pituitary gland, salivary glands, and tooth. In this, development as well as developmental anomalies of these structures must be done. In thorax and abdomen, only demonstration on the dissected specimens of the following structures have to be done. They are thoracic wall, diaphragm, heart chambers, coronary arteries, pericardium, lungs, pleural cavity, and bronchopulmonary segments. In abdomen, peritoneal cavity, and organs in abdominal and pelvic cavity. This is done to give an overview of structures in thorax and abdomen to the first year dental students. Clinical procedures have to be demonstrated in the lab involving sites of intravenous and intramuscular injections in upper limb and lower limb. In medical genetics, mitosis and meiosis, chromosomes, genes, and inheritance must be done. In the description of the video are available the links of the following: GCI Course Regulations 2007, PDF of detailed anatomy syllabus, playlist of videos on head and neck anatomy, more videos as and when added in the future for the dental students. The link will be shared in the description.